opinion, there's nothing worse than a migraine. It literally spoils your day. So, doctor, what is your take on migraines?
As you said, migraine is one of the worst physical conditions which everyone faces in their life. The pain is so much excruciating that you can't do anything, and all your daily activities and the whole day is spoiled. At times, it lasts from 3 to 4 hours to even 72 hours. That is 3 to 4 days it can last. And it's triggered by various reasons. Usually, migraine is one sided headache with severe pain and loss of focus. There will be aura, and it is the person will have hypersensitivity to light and sound. So, whenever he hears a loud sound or bright light, the condition worsens. Usually, migraine is related to either trigeminal nerve, vagal nerve, or gastric. And also, there are conditions where migraine is triggered due to certain cervical conditions.
Okay. Your thoughts, doctor?
Yes, in Siddha it is known as Otte Thalevali. In the name itself said it is one side of the head is completely very painful and hurts and all, and it releases confusion to the patient also. So in our concept it is because of the hyperactivity of Pitta humor inside the body. Literally in the common man's word it is heat inside the body. So it is highly related to the gastric secretions also. So as I told, doctor also mentioned about that. There is a triggering factor is cervical. Nowadays it is in the latest research it is a cervical issue. It is very prone to migraines and all. And second thing is if there is any severe gastritis or anything, it may trigger a migraine. A constipation can trigger migraine. And another thing is if there is any injury in the previous days, like in the childhood or anything, that causes a kshada in the marma. Later stages, after 18 years like that, it is mentioned in the Siddha text, it may cause a Otte Thalevali after certain years later. So we have to be very keen in the diagnosis in which area we have to be concentrate on that. Another dangerous or a condition is that a migraine is not only a headache, it is a premonitory symptom of a stroke also. So if it is a migraine and it is lasts long for more than 1 year, you must be very careful. You must consult a doctor. Even you have to take a CT of the head also. If there is any development, any aneurysm is happening inside the brain or not, because the symptom seems like a migraine also. Some cases it may mimics with the cluster headaches, because migraine it will have the severe pain in one complete side of the head, but cluster only throughout the eyeballs like that also. So we can differentiate like that, but the treatment pattern is the same. So in our concept we have to reduce the pitta the humorally, and afterwards we have to take some diet restrictions to reduce the aggravating factors that is triggering the migraine by the food habits. Okay.
What management can you recommend?
First of all, we have to find out the reason for the migraine. And another issue with migraine is most of the cases people take excessive use of NSAIDs, non-steroidal anti-inflammatory drugs, for headache, which you get through pharmacies, which includes paracetamol, brufen, and all. And such conditions actually, even though the pain reduces for the time being, the condition of the gut worsens, and it can create a long-term effect, including gastric ulcer, peptic conditions, and even it can bring a worse stage of migraine. So, first, care for the gut. It is the prime treatment for migraine. So, migraine, which is called as Ardhava Vedaka in Ayurveda, the best treatment is Pitta Shamaka. For Pitta Shamaka, we can go for many drugs like Leku Suta Shekara Rasa, Suta Shekara Rasa, Avipattika Churna, etc. And also some Kashaya like Intukantam Kashaya, which is good for immunity also. In this case, Intukanta Kashaya actually improves the gut bacteria. It is more of a probiotic and prebiotic action. So in such cases, the vasovagal reflex reduces and headache trigger lessens. Okay, and also there are many external applications in such cases. For a symptomatic relief, we can use Hridayaranjini our preparation, Shantigiri preparation is there. Hridayaranjani, it is effective. Then Padabhyanga, that is application of oil below the foot. On the sole, we can apply Kshirabala or Trifaladikera and slowly massage and make the body relax. Because stress can also aggravate the condition.
What about a Siddha approach?
Siddha is similar like that. The concept is almost the same. Like that, we have to reduce the pitta, we have to consider the stomach, we have to consider the digestion, and also the excretion also, and the factors that is symptomatically, what is the pain and all. So in our, there is some herbo-mineral combination like Aramuga Chanduram, Gauri Chandamani, Talisadi Churnam combination seems to be very effective for migraine and all. But actually this is a long-term management. At least we want a 3 months course for complete eradication of the migraine, because we want to reduce the symptoms as well as the root cause of the problem also. And the second thing is Citramutti Madakatailam. That is a Tamil version or the Siddha version of Kshirabala. That is also very good to instill into this for the Nasya purposes we can do. And Tala also.
Okay.
And there is a special type of Pugai. That is a installation of the smoke. That is with the Agasthyar Korambu. That is very effective to reduce the pain and all. And another thing is head massage, Shirobhyanga. It is very effective for migraine. Especially there is a Siddha preparation known as Arakatailam. That is very effective to reduce the pitta that is accumulated in the head, and also have to loosen or relax the mind and all, and it will reduce the pain also. That is a thing. In another concept in Ayurveda also, there is a good medication that we are Siddha people are also using is Abhyarishta. That is actually very good. We got very good result for migraine and all, for a consult therapy and all. So these are all the migraine section. If it is identified as a stroke condition, and if it is a promontory symptom of stroke, definitely we have to shift this medication to a stroke preventive medicines like that also. So we will choose the medicine according to that. And there is a special external application known as Nirkove tablet. That is especially for sinusitis also, but it will work very well for migraine, because the majority of the combination is manchal, the turmeric. That is actually a pitta shamana. So we will grind with some lemon juice and apply on the painful area, so that will consistently relieve the pain and all. So in order to that, we can combination of these all medication for a prolonged time. At least we want a 3 months for a complete management, because it is not related to a disease. It is also associated with some lifestyle and all. So we have to correct the lifestyle. There will be sedentary lifestyle. The night they will take so much of food, aggravated pitta food, spicy food. So we have to be clear and neutralize the body from acidity to alkaline. So buttermilk may help for that. Like that we can manage. So proper medication, proper diet, and some stress relieving yoga process also we can continuously, if you administer for a patient, we can control the migraine to a more than 95% like that. That is the Siddha concept for this.
Then in Ayurveda, we can do another method is application of Rasnati Churna for immediate relief in the headache. Rasnati Churna, when it is mixed with lime juice and it is slightly heated and then applied on the forehead, it reduces the headache. In the same way, we can use Kartavatta also. Kartavatta, Marmaguliga for external application for immediate relief. And also we can apply head oil daily, like Tulasi Surasadikera, Balahatatikera, Shiromukhi Kera, etc. So these are also helpful in such conditions. And if the cause of migraine is excessive stress, then we will go for IP treatments like Shirodhara, Shirobhyanga, Nasya, then Shashtika Shaliband as well, etc.
If you often suffer from migraines, acknowledge it at the earliest and take action.